Hello, everyone. Thank you for joining us. Welcome to the Avexia webinar series. Our topic for today is toxic molds, effects on humans, diagnosis and treatment. My name is Christopher Chu. I am the Director of Marketing for Avexia Diagnostics and will be your host for this webinar. Today, I have the distinct pleasure of being joined by an exciting guest, Dr. Andrew W. Campbell, who will be our presenter for this webinar. Dr. Campbell is a medical clinician, director, officer, advisor, and medical consultant, and editor-in-chief of several medical journals and research studies. He was selected as a top medical consultant of the year for 2020 by the International Association of Top Professionals' Outstanding Leadership, Dedication, and Commitment to the Healthcare Profession. In past years, Dr. Campbell has been recognized as one of the top 100 health professionals in clinical immunology and toxicology as an International Health Professional of the Year for his outstanding contributions to clinical toxicology, and was named countless times by marquee Who's Who as an expert in medicine and healthcare, and science and engineering across America and throughout the world. Aside from a successful career, Dr. Campbell is a sought-after lecturer and speaker nationally and internationally at medical conferences for over 25 years and at Oxford University in England and Harvard School of Medicine. He has published over 100 studies of his findings in peer-reviewed medical journals and medical textbook chapters. Without further delay, I will now turn the webinar over to Dr. Campbell.
Hello, everyone. This is Dr. Andrew Campbell. This is a evidence-based lecture on toxic molds, mycotoxins, and the disease and disorders they produce and how to treat these issues, how to medically treat these issues. This is just a little information on myself. I'm the editor-in-chief of various journals, co-editor, etc. I've published over 100 studies. I have chapters in medical textbooks. And as you can see, I lecture at various medical schools, and I'm a member of the Royal Society of Medicine. So how do you solve these issues? First, detect the cause. 2, remove the cause. 3, repair the damage. I see a lot of physicians, healthcare practitioners, etc., treating symptoms or giving many different supplements to where the patient is taking way too many that their body cannot handle. They become ultra-sensitive, etc. This is the way to solve it. So indoor mold spores induce persistent changes in inflammatory and immune responses, and chronic exposure to molds induce chronic inflammation. So here's a couple of scientific facts. Spores that are made by molds. So molds are like plants. Plants produce seeds. Molds produce spores, and these spores carry with them the mycotoxins. And the mycotoxins associated with these spores are likely to be absorbed through the lungs and going to other sites within the body, other organs, producing systemic effects. This has been known since the 1980s. And if you think that it's mainly through foods, etc., that is not the case in the medical literature. You'd literally have to eat a lot, like 14 pounds of rancid oatmeal, as an example. Again, this is all based on medical and scientific facts. So wherever the molds are that produce mycotoxins, and that whenever there's water damage, they're always present in a home or workplace that has had that damage, and they're always producing mycotoxins. And it's much more common than expected. In the United States, 85% of buildings have had past water damage. Well, 43% on top of that have current water damage. Okay, so 2 important points. A mold that produces mycotoxins produces not one mycotoxin, but a series of mycotoxins, not just one. But by the same token, if a mold known to produce mycotoxins is present in a contaminated home or building, then the mycotoxins it produces are present as well, which is basically pretty logical. Size matters. Hair, human hair is about 100 microns thick. Spores are 2 to 4 microns. What does that mean? That means when you're inhaling them, they go to the deepest part of the lung, right into the alveoli, and then are transferred into the bloodstream. And mycotoxins are 0.1 microns, same size as a COVID virus. So they're very, very effective in getting and going anywhere they want. How do they get in? Mainly by inhalation, our nasal sinuses, lungs, etc., through the skin. Again, ingestion is negligible. So what does inflammation caused by these mold spores bring? It brings all these different chronic disorders, and there's many, many more. Obviously, they can't fit on this slide. Let's look at autoimmune diseases, and mycotoxins are known as a trigger for autoimmune diseases. The frequency of autoimmunity in the United States over the past 3 decades has been rising at about almost 9% annual increase. Okay. And as you can read below, every one of these slides is going to have the actual citation or reference. So taken together, the number of people suffering from autoimmune diseases is more than all those who have heart disease and cancer combined. Okay, that's a huge amount. So mycotoxins trigger the onset or the exacerbation of chronic inflammatory diseases and autoimmune disorders. This is from a study that was published in 2021. Now, here's another issue about autoimmunity and biotoxins, especially molds. Postural tachycardia syndrome, POTS, myalgic encephalomyelitis, chronic fatigue syndrome, and autoantibodies are all linked to mycotoxins. This was published 4 years ago. So here are other publications that you can look up and find this about POTS and autoantibodies and chronic fatigue syndrome, etc. These are all published studies. Here's another autoimmune disorder, multiple sclerosis, that affects young people. Gliotoxin, the mycotoxin gliotoxin, has been shown to affect and damage all of these 3 brain cells: microglial cells, astrocytes, and oligodendrocytes. And by the way, oligodendrocytes are the cells that make myelin. So here's another study. Here's 3 studies that mention this, that the mycotoxin gliotoxins causes demyelination, leading to multiple sclerosis. And Rutgers Medical School published a study, a few years ago, that shows that we propose here that the fungal toxins are the underlying cause of multiple sclerosis. That is very important. Let's talk about Hashimoto's thyroiditis, which is not uncommon at all. Millions of people struggle with Hashimoto's. Okay, they eat normal amounts of food, exercise regularly, yet they're not getting in, and their thyroid levels are very difficult to treat. And that's because the cause are mycotoxins, not the thyroid. So once the treatment for mycotoxins is complete, the Hashimoto's goes away. This was, again, from another study. Here are 2 studies that show that patients presented in this particular study with normal function of thyroid or with the required treatment with T4, etc. So once the treatment was complete, the normal thyroid function returned. Rheumatoid arthritis. These two mycotoxins, deoxynivalenol and ochratoxin, increase the susceptibility of individuals to develop rheumatoid arthritis, or those who already have it. These two mycotoxins increase the clinical severity, and they elevate the levels of IL-1 beta and interleukin-1 beta, interleukin-6. And these were actually found in the inflamed joints. So this is a patient that I saw. You can see his ring finger swollen from arthritis, rheumatoid arthritis, and his skin showing psoriasis. This is psoriatic arthritis. Here's again, you can see his finger swollen, painful, his chest and abdomen. And here's after 2 months of treatment, and here is 6 months of treatment. Here is the mother of a doctor that if you go to conferences, you've heard him lecture. He asked me to help his mom. This is obviously psoriasis, an autoimmune disorder. And she sent me this picture, obviously taken on her phone, before and after treatment. Here's a young woman in her 30s. She wrote this herself. She was treated for SIBO. She was treated for Lyme, all these things. And we'll get into all that a little further down. But she started her treatment, and this is from June to September. That is not a long time. So in 3 months, she went this. Here's understanding the antibodies that I would like to explain to you. In microbiology, we were taught in medical school that there's 4 different pathogens: bacteria, fungi, pathogenic fungi, viruses, and parasites, okay? So after we've had an infection, exposure, etc., we develop antibodies, IgG antibodies to these, and we keep them as a weapon so that if they ever try to come back in again, they'll be wiped out. I'll give you a classic example. We all learned about hepatitis A, how you turn yellow, the eyes of your, scleras in your eyes turn yellow, and all this kind of stuff. Once you've had that, you can't get it again. So these 4 are living organisms. They have cell walls, and antibodies testing to these means sometime in the past you've been exposed. So if you get IgG to or any other immunoglobulin to molds, it means sometime in the past. It doesn't mean current. Now, toxins, including mycotoxins, or if you'd like, mercury, glyphosate, et cetera, are not alive. They don't have cell walls. They're just basically molecules. And antibodies to toxins indicate a current immune reaction, not exposure sometime in the past. Now, here's another key point. Once the toxins are gone from the body, and that usually takes months, sometimes years. For example, in mercury, which I just mentioned, it's anywhere from 18 months to 3 years to get rid of mercury, if you can get rid of all of it, because some of it is absorbed into bone. But in mycotoxins, about 6 to 8 months, you repeat the test with correct treatment, and the antibody reaction is no longer there. So let's talk about Lyme disease, because there's a lot of confusion about this in chronic Lyme. I published this article 5 years ago, and how to differentiate between the two. So this is from a study from Europe, and they took 29 members of a guideline group, medical guideline group. This is a consensus committee, 19 different medical scientific specialty societies in Germany, all of which are members of the Association of Scientific Medical Societies in Germany, as well as the Paul Ehrlich Society, the Robert Koch Institute, German Borreliosis Society, and 3 patient organizations. A panel of 5 expert scientists, including 1 representative each from Austria and Switzerland, All who had previously been co-authors on the guideline on Lyme neuroborreliosis, chronic Lyme, served in an advisory committee. Now, here's what they've come up with, which is very important for all of you who think there's such a thing as chronic Lyme. Both IgG and IgM antibodies can persist for several years despite a clinically healed infection. Second, and this is in late Lyme neuroborreliosis duration of treatment, a risk-benefit analysis yields no scientifically supported reason to change the current recommendation of 2 to 3 weeks of antibiotic treatment for the typical patient with late or chronic Lyme neuroborreliosis. Now, the putative therapeutic benefits of antibiotics for patients with persistent non-specific symptoms after a correct or incorrect diagnosis of chronic Lyme borreliosis. In other words, patients with so-called PTLDS or PTLDS-like symptoms was studied. They looked at this very carefully. Remember, we're talking about a number of medical societies in Germany, and with the participation of Austrian and Swiss doctors who have all published studies. No lasting improvement was found in any trial. No benefit was found with respect to either two endpoints, fatigue and quality of life, in continuing to treat with antibiotics. Now, 2 clinical trials in Europe of antibiotic drug efficacy established that only 2 out of 244, less than 1%, had microbiologic treatment failure, which means that the antibiotics failed to treat the Lyme disease. Findings from those microbiologic studies are substantiated by 5 clinical trials in the United States and Europe, and these have failed to show sustained improvement of chronic Lyme with additional antibiotic drug therapy. Now, an interesting fact is you can find antibodies to Lyme in 5 to 20% of normal people, depending on where they live and what age they are. So here's the diagnostic issues with Lyme disease. There's over 5 million Lyme tests ordered annually, but there's only 10% of that who actually have Lyme. Most of these tests are ordered with very low positive predictive value. Many tests are ordered for patients with chronic fatigue syndrome, fibromyalgia, etc. And patients can have a positive Lyme test due to cross-reactivity from other infectious or inflammatory diseases or previously treated Lyme disease. And many clinicians look for co-infections with Babesia, Bartonella, etc., but fail to look for mycotoxins. So what are the unsuitable tests that were found for Lyme? Well, here's the tests. And these include Vibrant, Igenix, etc. They're not suitable for any type of diagnosis for Lyme neuroborreliosis. Here's that VCS test, which is basically not very accurate, and it's almost a sham. So here are this is the information about chronic Lyme, and I see a lot of chronic Lyme patients after 1 year and up to 7 years of treatment with antibiotics. And what I see is those healthcare practitioners were treating the lab results and not the patient. So very common, and this is absolute logic. If you have the right diagnosis and the right treatment, the patient is well. If you have the wrong diagnosis and or the wrong treatment, patients get years of treatments and they're still sick. What is the most precise and accurate test for mycotoxins? This is MyMycoLab. It's available internationally, and it's both IgG antibodies which indicates a toxic reaction, 14 different mycotoxins, and IgE antibodies, mast cell activation measurements. Well, why do we say that, and how do they compare to, for example, urine testing? This is a study published about a year and a half ago in the journal Toxins. And what it stated is the variability of mycotoxin concentrations in urine is based on daily intake. And so you should sample urine at different time points throughout the day. And you have to normalize these with creatinine concentration. And because of the inter-individual comparison is challenging, why? Well, it depends on gender, age, diet, and muscle mass can all influence the creatinine secretion. How much did you drink that day? How much were you very active or not pretty inactive? All those things will factor in. And yet, what is the issue? The issue is that it is not, you'd have to do it several times during the day. This publication also said that the ELISA method, which is the method used by my mycolab to detect mycotoxins in human serum, comes with significant accuracy, precision, and specificity. And that's what we want for our patients. We want a test that is accurate, precise, and specific. Now, this is from Dr. Vajdani, who kindly allowed me to use his slide from a presentation he gave at a medical conference. And it's on the use and limitations of organic acids for gut health. And it comes from a guide. Several popular organic acid tests claim to detect imbalances in gut bacteria and fungi. But most of these microbial markers on these tests do not measure what they claim to. And here's the other thing about urine testing. Look for the body burden of chemicals, not chemicals coming out in the urine. The same goes for mycotoxin antibodies or mycotoxins in urine. What's left the body, it has left. What about what's in the body still? That is what affects you. So let's go on treatment. We know now what diagnosis, and all these patients who have Lyme and autoimmune diseases really can be treated by going to mycotoxins. Now, first and foremost, the first rule of toxicology is get the patient away from the toxin or the toxin away from the patient. And second, at the same time, you build back up the immune system while giving an antifungal. And this has been shown in numerous publications and studies, even chapters in medical textbooks. So again, if the person isn't getting better on the treatment, it's because they're still being exposed. It could be at work, it could be at the gym, or that they go to on a regular basis, or it could be at home. The EPA says about 50% of indoor mold is not visible. It's in between walls. It's in between or under tiles. It's in the air conditioning and heating ducts in your house. You can't see those. And so you have somebody come and test and they don't find it. They haven't looked the right way. 80% of the immune system is in the gut. So let's begin there. The main components will be diet, supplements, and probiotics. What works for probiotics is spore-forming bacilli. Let me explain that to you. Dr. Simon Cutting at Reading University in London did studies on the more common probiotics. Okay, these are Bifidobacterium, Acidophilus, etc. And some have this many colony-forming units, that many, etc. Lactobacilli and Bifidobacterium. Well, what he found is that more than 90% die in the stomach from the acidity. He called that dead bacteria therapy. So he looked for what does become a probiotic, and these were spore-forming bacilli. And diet, I recommend all my patients, you do gluten-free for 90 days and avoid dairy, sugar, and soy. And what about the antifungal? Itraconazole. If you get on Dr. Google, itraconazole is going to make your hair fall out, your teeth fall out. It's going to make your liver shrivel up and all kinds of things. But are they looking at evidence or just somebody said so? Well, it's usually because somebody said so, not medical and scientific evidence. So here is the medical and scientific evidence, okay? And what it shows that has favorable pharmacodynamic and pharmacokinetic profiles, oral and IV formulation, and it's really been effective and well tolerated with doses of up to 400 milligrams per day, generally free of serious adverse effects. Here's another study that itraconazole, also known as Sporanox, is a common antifungal that was developed in the 1980s. Okay, has been in clinical use for 35 years with an established safety record. Now, this study was published 7 years ago, so 35 plus 7 is 42 years of established safety record. And here's voriconazole, the cousin. And in patients with acute on chronic liver failure and continuous renal replacement therapy, was not effective. It did not adversely affect these patients. What about cancer? So look on the left, those two left pictures, okay? Amazing. That's on the top of the forehead of a patient. Then they give itraconazole. Look at 2 months, 59 days of therapy. Can you see the effectiveness? Obvious. Let's look at fluconazole and itraconazole, because I have seen a lot of patients who are given fluconazole, ketoconazole, and various other things, thinking that's going to help. No. Candida is a yeast, classical opportunistic pathogen, and resides harmlessly in approximately 50% of people on the planet, and it's kept in check by the immune system. Fluconazole prevents candidiasis. It has no activity against molds. So this was published way back in 2004. So here, there's two types of molds. Single cell molds, all the yeasts that are used in making bread, alcoholic beverages, et cetera, et cetera. And there are multiple cell molds, such as the ones that are Aspergillus, Stachybotrys, Penicillium, Fusarium, et cetera. Fluconazole only works against single cell. Itraconazole works against both single and multiple cell. I also give my patients phosphatidylserine. Why? From this study. It was a placebo-controlled, double-blind, randomized study. It enriches myelin, which we showed earlier in the previous slide, that's one of the areas that's depleted by mycotoxins. It also influences the metabolism of neurotransmitters, including acetylcholine, norepinephrine, serotonin, and dopamine. It stimulates enhanced performance on tasks that test learning ability and short-term memory use. Compared with the effects of placebo, phosphatidylserine, not choline, serine, produced significant improvements in short-term recall, immediate memory, vocabulary skills, ability to recall words, attention, and vigilance. Well, I think we all want that. Here's melatonin. Why do I recommend melatonin? It's not for sleep, although that will help patients sleep, but it reduces the cellular damage generated as a result of the metabolism of toxic agents. These are studies that were shown at the several studies that were published and done at the University of Texas San Antonio branch. And also melatonin's ability to protect neurons from molecular damage due to a wide variety of substances, including mycotoxins. Well, and it only needs 3 milligrams. You don't have to give these huge numbers that I see all over the internet. Magnesium, I published this over 10 years ago, okay? It's 11th most common element in the human body, and it's involved in 350 enzyme systems. For example, if you don't have enough magnesium on board, you cannot absorb vitamin C, okay? So up to 80% of the population is deficient in this. And magnesium binding sites have been detected in over 3,700 human proteins. And these proteins are essential for the building, repairing, and maintaining of cells in our body. And it's a cofactor for ATP, which is our energy metabolism. And, which breaks down proteins, carbohydrates, and fats and converts them into ATP. You remember this from basic sciences. And it's a required cofactor for vitamin C. And it's also a cofactor for zinc, potassium, vitamin B complex, calcium, and vitamin D. It would be difficult to absorb and use these without enough magnesium. So let's take a look at B complex, because this is something I also give my patients, okay? These are 8 water-soluble vitamins, and they help brain function, including the energy production, DNA, RNA synthesis and repair, genomic and non-genomic methylation, and the synthesis of a number of neurochemical and signaling molecules. On top of that, research in humans shows a significant proportion of the population of developed countries suffer from either deficiencies or insufficiencies in one or more of this group of vitamins. And that, in the absence of an optimal diet, administration of the entire vitamin B group, rather than just one like B6 or just B2 or whatever, at doses greatly in excess of the current government recommendations, would be a rational approach for preserving brain health. D3, vitamin D3. It's very helpful in cognitive impairment, vascular dementia, Lewy body dementia, and other conditions that develop due to brain cell malfunction or cell death. And low vitamin D levels are associated with increased cognitive impairment, diabetes, cardiovascular issues, cancer, and respiratory diseases. What about chronic sinus issues and problems? This is Dr. Ponikow published this study on 210 patients. He cleaned the sinuses out of these patients with chronic sinus issues. 96% was due to mold. He actually petitioned that the term be changed to chronic fungal sinusitis or rhinosinusitis. What was the treatment? Intranasal amphotericin B and used itraconazole. So let's look at the big thing on binders that are so popular. I asked this one mold so-called expert on why does he use it. He says, well, because they help get rid of mycotoxins, et cetera, et cetera. I said, can you show me one paper? No, there aren't. He said, I don't know of any. Well, there is one. Binders rely on the absorption of mycotoxins from the gut, okay? So kaolinite, clays, zeolite, activated charcoal, bentonite, blah, blah. They're effective in neutralizing aflatoxin. Aflatoxins don't occur in indoor environments. They're ineffective. All these binders are ineffective in all other mycotoxins. On top of that, they bind vital vitamins as well as macro and micro elements. And you can say, well, I tell them to take the binder this many hours before or after or all that. Sorry, doesn't work, doesn't help. And if it does, please feel free to send me the study. Here's our sham or not helpful studies. Neuroquant. It's basically for Alzheimer or shrink. It's how much, what the size of the brain is. So if you have TBI, Alzheimer, then it could be useful. SPECT is much more useful in clinical medicine. And you can read up on the usefulness of this. Dr. Daniel Amen has published a number of studies. Marcons, that's a big joke. It doesn't exist in medicine. There's not recognized anywhere in medicine. There's no articles. Same goes for MSH, C3A, C4A, and all those tests that are popular among the Shoemaker, Neil Nathan crowd. There's no evidence. VCS, no evidence they have anything to do with molds or mycotoxins. Hey, oh, and the HLA-DR test. Well, it's supposed to affect 25% of the population. That means 82 million Americans. But there's no studies showing HLA-DR to anything with molds or mycotoxins. So there's no research. It's not taught anywhere. There's no basis in medical science. But let me show you something that affects 34 million Americans, almost 15 million less than this so-called HLA-DR. It's diabetes. Okay? Yeah, and there's all kinds of things on diabetes all over the world, but this HLA-DR, there's nothing written about it. That's another scam. Let's talk about mast cells, because there's mast cell activation disease, mast cell activation syndrome, etc. And again, here's a couple of studies, and in a group of doctors from Washington University in St. Louis, we just published in April last month a study on this. This is how ochratoxin increases significantly interleukin-6, suppresses N-acetylcysteine, and increases the susceptibility of rheumatoid arthritis, causes inflammation of the nasal mucosa. Okay, so IL-6 mast cells are stimulated, are producing IL, and then create IL-6. In other words, when mast cells are hit by IgE antibodies to mycotoxins, yes, mast cells are known to produce heparin, histamine, et cetera, and various other factors. But when it's a toxin, IgE mycotoxin, they start releasing IL-6. So here's two mycotoxins, Alternaria and T2 toxins, that all stimulate these mast cells. Here's a couple of pictures, photographs from a patient of mine. You can see her legs, her thighs, upper legs, and wrists. And here she is before and after. She's showing her wrists in the picture right, and her neck is clear. And we talked about food and mycotoxins in food. So read the last three lines. An adult with a body weight of 170 pounds would have to consume 14 pounds of ready-to-eat oatmeal or 20 slices of bread. Now, these are all moldy in order to have your gut affected. Why? Publication on molds, mycotoxins, the brain, the gut, and misconceptions, and co-authored with Dr. Leonard Weinstock and myself. We showed that the gut actually helps helps detox, as it's called popularly, from mycotoxins.
For any questions or issues you may have, please contact Avexia Diagnostics by email at info@avexiadiagnostics.com or by phone 5 days a week at extended hours, 8 a.m. to 8 p.m. Eastern Time at 888-852-2723. Thank you, Dr. Campbell, for this informative presentation. We all thank you again for joining us. Until next time, from everyone at Avexia Diagnostics and My Myco Labs, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.